The recent global pandemic has made it clear that health is a public concern. Yet, access to healthcare remains unattainable to nearly half of the world's population.
Figuring out how to manage the economics is a really big issue.
The island of Taiwan has created a model of universal healthcare that promotes health equity.
我用这么小的成本就开办这么庞大的一个社会工程。
But new technologies, drugs, and treatments, and an aging population are testing the system's limits.
We are the first line for the community resident.
这个药是所有的药里面最贵的。
From primary care clinics to leading medical centers, medical service providers must adapt to the changing environment to safeguard the health of their communities.
Now we have a game changer.
我们在健康的照护上都能够获得同等的水准，这才是健康平等。
Taiwan's struggle and success may shed light on the issues challenging healthcare systems worldwide. On an August morning, Kuna Silan drives down the winding road around the Balung area in Taoyuan City in northern Taiwan, home to many indigenous Atayan tribes. Situated over 1,000 meters above sea level deep in the mountains, it is one of the most remote regions in Taiwan, with a population of about 1,500.
这个是我要来接的。
The younger generation has moved to the cities for better opportunities, while the elders have stayed behind.
他们有医疗需求，就带他们去看诊。
After a short drive, they arrive at the Hualing Health Station. A sense of excitement is growing among the residents. Today is the annual health fair.
今天是我们3D 医疗就1年一度的大型义诊。那今天上来科别像有复健科、那牙科、中医还有肠胃科，同时都有在。
Jia Qigu is the nurse in residence at the health station. Apart from offering medical treatment, the medical team also showcases several services on offer the residents may be unaware of.
一个比较特别的是，我们有做了远距医疗的示范。
所以这位病人他的左眼要担心是一个早期的这个青光眼。
The health fair also allows the medical team to review the quality of their own services.
很好的建议 ，X 光片呢也都是用那个数位的方式。
Dr. Chong Liangxi, Director General of the National Health Insurance Administration, visits the health station to make the quality assessment.
3D 离岛医疗资源比较不足的地方，那么我们会透过邻近的一些医院，定期的去开设门诊、专科的门诊、巡回医疗的服务，或者是一些24小时的急诊服务。
现在有正常在吃吗？
有正常，除非是很忙的时候，我会忘记。
Hualing Health Station has been operating for over 2 decades as part of the administration's Integrated Delivery System, or IDS, a project to provide healthcare to underserved communities.
所以你来这里的时候就住后面，都住在这里。
Gu is not from the area. Instead, she and the physicians travel from the city weekly to work in the health station, a setup funded by IDS.
我原本是在胸腔内科当护理师，护理长就问我说，他说山上有一个需要代班的机会，问我有没有兴趣。
Gu eventually took up the full-time assignment at the health station. She is there 5 days a week to assist physicians from different departments who rotate over the week to serve patients with various needs.
医疗站有3个诊别，就是从早上9点到晚上9点。我们有24小时急诊的服务。那如果我需要的病患，都还是可以来看诊。
那我们这个吃药只能让症状比较缓解。
The nearest hospital is about 90 minutes by car. For patients with medical emergencies, the distance makes a difference between life and death. It was something the locals had experienced firsthand in the past.
上午10点钟，这辆游览车载着46名树林登山会的会员， 在爬坡的时候马力不足，导致游览车坠落山崖。
In July 1988, a tour bus plunged down a cliff near the village.
那当初没有护栏，就这样冲下去了，整个车后退，一直掉到底下那条路。
Yongsheng Chen remembers the accident clearly to this day. He was a member of the township council at the time.
那时候路不方便，也没有什么急救的那些车子，所以有好几个就在半路就断气。
14 people died in the tragedy, and 38 were injured. It was the deadliest accident in the town's history.
我们就立刻反映县长说，这个地方需要有一个急救的医疗站。
At the time, universal health coverage was not yet available in Taiwan. With their meager farming income, the villagers often couldn't afford basic medical services, let alone sustain an emergency medical center that needed to generate revenue to stay open.
因为以前没有什么医疗资源，所以一有生病就是自己想办法，有办法就到都市去看病，真的没有办法的人就听天由命了。
The void in regular medical services in the late 1980s meant that the health and lifespan of Balung's residents were among the worst in Taiwan. Unfortunately, this is a universal phenomenon. More than 56% of the world's population lives in cities. The health gap between the urban and the rural populations has never been wider. Taiwan was determined to reverse this trend.
我相信全体同仁都能够为全民的健康来着想。
Dr. Boya Zhang was Taiwan's Minister of Health from 1990 to 1997. By the early 1990s, more than 40% of the population in Taiwan did not have medical insurance.
我们实施全民健保，就是要让全体国民都受到医疗跟健康的照护，让台湾的民众不会没有钱看病，也不会因病而穷。
But first, she had to figure out the finances, as the existing medical insurance schemes were heavily subsidized by the government and saddled with debt.
如果不把它整合的话，政府的负担也是相当的惨重，都是亏损。我们是在腐烂的根基上盖大楼。
A healthcare system can quickly sink in a quagmire of debt. Harvard University's Professor David Cutler has been studying how to solve the conundrum. He is a health economist who had served as the senior healthcare advisor to former U.S. President Barack Obama.
We can't go back to the days when insurance companies could just drop your coverage because you're sick.
We think about judging a healthcare system along probably 3 dimensions. One is the cost of the system. Second is the access. And then third is the kind of technical quality. And the accessibility really comes from the cost part. The higher our costs, the less able you are to afford accessibility for all. How much should we pay pharmaceuticals, hospitals, pay nurses, home health aides, and so on? All of that becomes very, very complicated.
Taiwan's Ministry of Health assembled a committee to draft a master plan and conduct the actuarial calculations. Dr. Qing Chuanye was the chair of the preparatory committee.
财务规划做了一个很对的事情，就是把所有的保险把它合并成单一保险。
The universal coverage model, funded primarily by payroll-based premiums, triggered social tensions.
包括医师，包括劳工，他们都游行示威抗议的。我们办了1400多场宣导，让劳工了解，让雇主了解全民健保的实施。
On March 1st, 1995, Taiwan's National Health Insurance, or NHI, was implemented after years of preparation.
健保一开始其实是担心财务嘛，第一个月那个缴汇率是98%哦，是比那个国税局的还高。第一年下来的时候，大概就知道说财务是可以被控制的，所以政府反而松一口气，就是我用这么小的成本就开办一个这么庞大的一个社会工程，民众满意度到1年的时候60%。
Now, over 99% of the population in Taiwan is covered by NHI. The success allowed the NHI administration to consolidate existing medical services, distribute resources, and launch other healthcare schemes, including the integrated delivery system.
目前看起来都在打针了，吃药大概2-3天就会比较好。
以前在偏乡地区没有医疗院所，现在我们用医疗网扩建医院，让医院能够均衡分布于各个地区。
Today, the IDS program supports 50 remote townships, covering around 500,000 residents. In Taoyuan, the administration works with the city's Changgung Memorial Hospital and St. Paul's Hospital to provide medical support in the Balung area. In 2002, the long-awaited Hualing Health Station opened its doors to the villagers in neighboring areas.
哪一边？上面这边。
医疗站成立以后，真的给我们地方极大的一个方便，尤其是健保的给付，解决我们后山以及比较贫困地区的医疗困难。那小病的话，可以在这边看完；比较重大的，就由救护车转诊到外面。我自己也坐了2次救护车，心脏的问题，这个地方是对急救来讲帮助很大，救了好多的生命呢。
It gives Chen and his fellow tribespeople peace of mind to know that they never need to worry about accessing good quality healthcare anymore. Back in Taipei, the NHI administration has another dilemma to resolve. As technology advances, ever more new drugs and treatments are becoming available. Deciding what treatments to cover is a quandary for every healthcare system worldwide.
那这个药品的话，它是基因治疗，那它是宣称一辈子它只要打1次。
Director General Xu and his team must decide if the NHI will cover an expensive new drug to treat a rare disease that affects 1 in about 18,000 newborns. Ken Huan became a happy father to a baby girl at 36 years old after he and his wife had difficulty conceiving.
因为我们算属于高龄，好不容易有个小孩是非常难得的。刚出生的时候，我们非常的开心兴奋，医生就问我们要不要做健康检查。1个礼拜，医生就打电话说：“你小孩有 SMA 这个疾病。”
SMA, short for spinal muscular atrophy, is a rare genetic condition that results in neuromuscular disorder. The nerve cells that control muscles don't function properly, causing progressive muscle weakness. It is the most common genetic cause of childhood fatality. Most infants with type 1 SMA die before their second birthday.
我们的心情就从天堂掉到地狱。
Even if children with SMA survive, they have to manage to live with profound disabilities. 22-year-old Qingwei Chen is one of them.
我是在出生8个月的时候确诊的，那罹患的是 SMA 第2型。
SMA type 2 patients have a 70% survival rate up to age 25.
从小到大没有 SMA 的药物可以治愈我的疾病。我记得幼儿园的时候我还可以自己举手，今年我只剩下唯一1根手指头可以动，在农历的春节那1根手指头也不能动了。那现在几乎都是仰赖眼控滑鼠。
Despite the devastating disability, Qingwei becomes a motivational speaker and published author. He also runs an integrated marketing studio after graduating college with first-class honors.
我目前生活中最大的愿望就是，我希望身体可以不要再萎缩下去，还有很多事想要完成。
Because SMA is a degenerative disease, Ken is determined to find treatments before his daughter starts to develop symptoms.
可能在2岁以内会突然发病，开始肌肉萎缩，甚至不能自己吃饭，不能呼吸。可能过不到2岁。好不容易有一个新的生命，希望能够让他健康活着，想尽各种方法。后来在高雄找到中医师。
Dr. Yu Ji-zhong is a specialist in neuromuscular diseases and a professor at Kaohsiung Medical University. Both Ken's daughter, Xun Xun and Qingwei, are his patients.
过去36年来，我一直从事罕见神经肌肉疾病病患的服务。过去是有症状以后才治疗，那随着时代的进步 ，SMA 开始可以治疗，所以我们现在比较积极前瞻性的治疗。
中医师诊断之后，跟我们说有3种药可以治疗它。
Since 2016, the U.S. Food and Drug Administration has approved several new treatments for SMA: a spinal injection, a gene therapy, and a small molecule oral medication.
脊髓用药跟小分子口服用药都是需要一辈子，基因治疗是只需要一次性的用药。
The one-time gene therapy Zolgensma can be used to treat children less than 2 years of age. Ken was excited to learn that Shunchun fits the profile. But what he didn't know at the time was how much the treatment costs.
SMA 的药物因为属于罕见疾病，所以研发成本比较高，价钱就会比较贵。
那个时候我们才发现，原来这个药是没有健保给付的。
At the National Health Insurance Administration's meeting, Director General Chong Liang-shi listens to a presentation about the SMA's new treatment.
那这个药品的话，宣称一辈子他只要打1次。
The new drug sounds very promising in treating the most common genetic cause of infant mortality. But there's a catch.
1次的一个费用的话是4900万。
Zolgensma was the most expensive drug in the world when it was licensed in the United States in 2019.
健保因为它是有限的资源，我们怎么把这个资源放在刀口上，要达到最大的效益？哪一些是具有成本效益，我们要优先纳入健保。
健保署关心的是这个药是真的有效，那这个药能持续多久？副作用有多大？
The NHI administration must conduct a thorough evaluation and hearing before deciding whether to cover the treatment, a process that can take months, if not years. But Ken's daughter is running out of time.
当下妈妈她说我们一定要救她，最坏的打算就是抵押借款来慢慢去负担这个医药费。
Yet, expensive new treatments are only one of many challenges the healthcare system must deal with. Nearly 3 decades after its inception, Taiwan's NHI finds itself in an entirely different healthcare landscape from that which existed at its origin.
1995跟现在的这个时空环境已经差很多了哈，现在越来越多那种新的科技、新的仪器，那很贵啊，其实健保也付不起。
However, technological developments may also be the answer to the cost issue by improving medical service efficiency and quality, and in turn, help save patients' lives. Jane is one of those patients.
我是在9月初的时候发现很容易胀气，就是有一点恶心，到平常的诊所就诊。医生告诉我说，这就是很普通的消化不良。看了2周以后，觉得症状并没有改善，后来还浮现了黄疸，我就直接到大医院去就诊。
After running a computer tomography scan, or CT scan, with an endoscopic biopsy, doctors at the first hospital confirmed signs of a cancerous tumor. What they couldn't confirm, though, was where the cancer started.
最后开给我的诊断证明呢，就是开壶腹周围癌。壶腹周围就是有很多的器官，他们没有办法断定原发自哪里。
To treat cancers, time is of the essence. At this point, it had been 6 weeks since Jane started showing symptoms.
这种恶性肿瘤的话，它的变化程度真的非常的快。
The doctors at the first hospital referred her to the National Taiwan University Hospital.
我就把电脑断层的影像给了台大团队。
Within 3 days, Jane receives an answer.
在这里有一个 positive 的字样，就是阳性。
She is diagnosed with pancreatic cancer. Dr. Wei Qi Liao is a gastroenterologist at NTU Hospital.
In the clinical setting, we mainly use imaging studies, mostly CT scans, to detect pancreatic cancer. Pancreatic cancer spreads and grows rapidly. But the early pancreatic cancers, smaller than 2 centimeters, that we want to detect are very difficult to see. Once the tumor grows beyond 2 centimeters, usually the cancer spreads beyond the pancreas and it responds poorly to current treatments. The best strategy to improve the prognosis is to detect the cancer at an early stage. 看一下这个 AI 的这个分析的结果了哈，所以我想我们有很大的信心，所以应该要赶快来做治疗。
Only around 5% of pancreatic cancer patients are diagnosed at an early stage and in time for potentially life-saving surgeries, making it one of the deadliest forms of cancer. Jane's tumor is roughly 1 centimeter. PancreaSaver, an AI-powered diagnostic tool developed by the team led by Dr. Liao, is behind Jane's early detection.
Early pancreatic cancers sometimes are just invisible, are not possible for our eyes to see. We want to train an AI model that can see what we cannot see.
Dr. Liao teams up with Dr. Wei-Chong Wang, a professor at NTU's Applied Mathematical Sciences Institute, and Dr. Po-Ting Chen, a radiologist, to develop the AI model. To train an effective artificial intelligence model, the team needs reliable clinical data. Thankfully, NHI requires all its member hospitals to upload patient data into a central database. NTU has access, therefore, to a robust data set. Dr. Wei-Chong Wang is charged with building the model.
We want to help doctors to make a better decision in diagnosis. Every type have their own challenges, but I would say pancreatic cancer is probably one of the hardest. In the beginning, we have collected more than thousands of data from National Taiwan University Hospital. To do the analysis over the large scale of computing is not easy. We need to develop new algorithms to achieve higher performance.
To train the AI model to identify cancerous cells in the pancreas, the team relies on the expertise of radiologists.
我是台大医院影像医学部的医师，那我主要专精是在腹部的影像的判读。那我们现在可以看这个，这是一个胰脏癌的病人。这个地方啊，就是有脚的肿瘤的地方。我们看到这个位置，就把它圈选出来。想它是一个球体，那电脑断层就是这样一张一张切，所以我们就要从最上面那一张一直到最下面那一张，把这个肿瘤全部都画完。
It takes about 20 minutes to annotate a cancer case. The team aims to begin with at least 600 case studies. It's a laborious and time-consuming process. Dr. Chen hopes that medical AI will help solve the underlying problem in medical imaging. Each CT scan session produces around 500 images, with 10 to 20 patients to see daily. A radiologist often reviews up to a whopping 10,000 images every day.
我们在台大医院有统计，我们如果比较2005年跟2020年，检查数量成长了3到4倍。可是我们的医师其实成长数量没有那么多，工作量是非常巨幅的成长的。
A working AI model will benefit both patients and doctors. Next, the team must prove the model's versatility in different environments.
We collect data from one hospital and we develop an AI model which has a very good performance. This is not enough. So we need to make sure our model can be generalized to other hospitals.
AI detection of pancreas cancer must prove consistently accurate before it can be widely adopted by hospitals.
When you go into the real world, different hospitals can have different CT scan equipments. There are various clinical conditions in order to know how well the model can perform in real clinical settings. So we use a nationwide real-world data to test it.
Starting in 2018, the NHI administration has requested that patient medical imaging files be uploaded to its cloud data centers. The agency grants worthy clinical trials access to its database.
有这边我们就可以看到它的那个 usage 对。
The NHI database test shows that Pancreas Saver has an overall sensitivity of 91.8% in detecting pancreatic cancer and a sensitivity of over 74% in detecting pancreatic tumors smaller than 2 centimeters.
Now we have a game changer.
It has certainly changed Jane's cancer treatment.
10月中下旬确认以后，10月25号来台大门诊，然后10月30手术。
She recovered very well from the surgery. Now we have a very good outcome.
Pancreas Saver has received approval from Taiwan's FDA and the US FDA's Breakthrough Device Designation status. It is available at the NTU Hospital for patients seeking to detect pancreatic cancer and is expected to roll out to other hospitals in Taiwan.
AI technology will help doctors make better diagnoses, patients receive the treatment sooner, and also save a lot of healthcare costs because patients receive less unnecessary examinations.
Since its inception in 1995, Taiwan's National Health Insurance Program has amassed a huge amount of data. Advances in technology can now put this data to life-saving use. Inside the head office of the National Health Insurance Administration, experts and government officials are deliberating a momentous decision: whether to cover $1 million treatment for SMA, a rare genetic disease that causes the highest rate of toddler deaths.
那么主要的评估呢，大概有2个部分，一个当然是疗效，第二个呢，当然我们要算成本效益，就是说这个药呢高达4900万，是所有的药里面最贵的。
Since SMA's gene therapy Zolgensma became available in 2019 for patients 2 years of age and younger, NHI administration has been evaluating its coverage. Considering NHI's finite resources, it's a difficult decision to make.
我们一开始就是希望等待那个健保起付。他在出生3个月，我们过的生活就是每天在担心，发现他精神不好，就会觉得他是不是开始不能动了。
The wait is so agonizing that Ken and his wife consider going into debt to pay for the treatment. But Dr. Yu Qizhong brings them some good news.
后来中医师就透过药厂让我们能够使用到基因治疗的药物。
当时全球有提供100个免费的名额，我们很幸运得到这样的机会，让我们试用。
这个药毕竟它比较特殊了哈，所以我们也会有专责药师会在当天 stand by。
In 2021, when Ken's daughter Xun Xun was 3 months old, she received gene therapy treatment through a compassionate drug use program that allows the use of medicine that has not yet obtained Taiwan's FDA approval.
现在已经2岁多了，比平常人的活动力还旺盛，蛮神奇的。
就是刚好我们有机会在委员会里面跟健保署全体的委员专家报告使用基因治疗这些病友他们得到的结果，也让委员们对这个药物有更多的了解。
我们现在另外的一个药物，它必须持续性的服用，10年的药费也差不多将近要5000万。这个药物它如果是可以终身不发病，2个相比较之下，不论是对孩子的发展，或者是对家庭的负担，我都觉得它是非常具有成本效益。
In August 2023, Taiwan's NHI administration approved SMA's gene therapy coverage. On August 23rd, 4-month-old Xiao Bao was the first patient to receive the treatment covered by NHI. He had started showing symptoms, including floppy arms and legs, along with weak crying. Just 2 months after his treatment, he's able to roll on his own and has a powerful cry just like any other baby. It brings hope to other SMA patients.
我觉得很感动，他们就可以不用经历了我很多身体功能渐渐失去的那件事。期待我自己有一天是可以用药的，必须维持现阶段的所有运动功能。
Qingwei gets regular rehabs to maintain his motor function.
复健或者是看诊这部分都还有健保的指引，可能常常会因为某一个小病就必须去医院，所以我觉得政府对于病人来说是友善的。
健保的一个精神就是对于弱势者的照顾，我们把它分成3种弱势，一种叫做生理的弱势，一种是经济的弱势，一种是地理的弱势。这个生理的弱势，它需要花费很多的钱，会严重的影响到他的家庭的经济，所以在健保里面还要有独立的预算。
However, technological innovation is only one of the factors that are changing healthcare systems worldwide. While rare or cancerous diseases affect part of the population, there is a risk factor whose impact is felt by everyone.
世界上的各国的发展来看，会影响医疗支出最明显的因素，一个就是新科技，一个当然就是高龄化。
Aging puts a lot of challenges on the healthcare system. So as people get older, their use of medical care climbs, and also they're not working, so the tax revenue falls.
Taiwan is aging quickly. By 2025, 20% of the population will be 65 or older. The number reaches 30% by 2040. It needs to revamp its healthcare program before the system is drained.
Figuring out how to manage the demographics and the economics there is a really big issue. You'd like people to be healthier so they don't have to spend money until later years.
In Puli Township in central Taiwan, a forward-thinking primary care physician and a technology development institution are experimenting with new approaches to the issue.
我这个波动我弄直接投上去，可以啊。
Today, Dr. Samuel Chen, a primary care physician, is meeting with Kang Him Ma, a data scientist from Taiwan's Industrial Technology Research Institute, or ITRI, to test a cloud-based platform that collects data for primary care service providers.
这些资源现在大多都集中在医学中心、基层诊所、数位相关的一些需求，比较容易被忽略掉。陈医师的诊所啊，除了医疗数据之外，它还有一些其他的数据。
Apart from relying on medical data, Dr. Samuel Chen collects lifestyle data, including his patients' diet and exercise routines, to help provide better treatments.
There are more elderlies living here. When they get older, there will be more and more chronic disease.
According to Taiwan's NHI, diabetic-related medical spending ranks the second highest. The first is kidney disease, which is linked to diabetes.
So it will be a big burden for the country. Puli is my hometown. As a medical service provider here, we really want to do something. We are the first line for the community resident.
In countries with health coverage, it's really important to have this strong primary health care as a gatekeeper to the system.
Dr. Maria van den Mausenberg is a general physician and the chair of the European Forum for Primary Care, a not-for-profit group advocating for strong primary health care.
Because primary care is the best means to provide good quality, person-centered care for low costs for everybody.
To safeguard the health of his community, Dr. Chen has been developing a holistic approach to treating diabetic-related diseases, an effort supported by NHI's Diabetes and Early Chronic Kidney Disease Integrated Care Program.
Diabetes is a lifestyle-related disease. We try to develop the lifestyle intervention combined with the medical service. We have to know the way they eat, the way they exercise.
体重好像也有再上来一点呢，
有胖3公斤，最近没运动。
你要回到你之前啊，之前那么认真的有去运动啊，对不对？
In 2016, Dr. Chen set up a gym, a canteen, and a community classroom next to his clinic to improve patient education and quality of life. Senior Fitness Club is specially organized for older patients. 68-year-old Jin Daijang is one of the club's most active members.
一般咧行路只是干那骹尔，伊爱运动算讲全身拢有扭着，较全能的。
Jintai was diagnosed with diabetes more than 10 years ago. She has been diligently managing her condition. It is a lesson she learned from her family tragedies.
因为阮这算讲有家族性的遗传，阮这拢三个拢是低血糖过身去，因着先拢无控制好来，我嘛是会烦恼啊。
Inside this gym, Jintai's health and workout data is collected and monitored. As information technology advances, Dr. Chen sees an opportunity to integrate lifestyle data into his practice.
What we see is the value of data. During our daily practice, we notice that every data being separated. You just cannot see all the data in one screen. It's quite challenging.
So he signed up to try out eTree's platform.
我们帮他把这些资讯都串起来到同一个平台，所以他之后可以同时看到这个病患他的医疗资料啊，还有运动的过程，还有其他健康相关的资料，包含了心率、功率、血糖资料都会呈现在这边。
Then when the patient came back to the clinic, I can check out the data, giving them feedback.
This allows Dr. Chen to prescribe more personalized treatment options for patients with chronic diseases and improve their health outcomes.
In Taiwan, we focus too much on the specialty and subspecialty. However, if residents here can receive proper medical service, they don't have to go to the medical center in bigger cities.
In an aging society, primary healthcare is important because it's nearby the patients. Primary care physicians address all their needs. So this is very different from a system where the elderly patient has to go to the hospital.
Dr. Chen's medical team helps Jintai manage her health challenges.
自从来这运动了后，感觉讲人安尼较轻松，比较较袂疲劳。体脂肪多少？体脂肪有较低，血糖有较降。咱遮护士，若3个月伊就会敲电话叫你讲转来抽血检查，算嘛真用心啦。所以咱家己的身体，咱家己爱照顾好来，莫有囡仔有负担。
In 2025, Taiwan will become the super age society. The medical expense is growing, however, the funding is not enough. So we have to keep them as healthy as possible. As a primary care physician, we provide preventive medicine. I think that's our value. That's a clinic's value.
Prevention is better than a cure. For many primary care service providers, it's not a slogan, but a creed. The belief is shared by Taiwan's active civic society, which has played a pivotal role in improving health equity over the years.
Oh, 3个准备握拳。
台湾血液基金会是捐供血的公益团体，捐血最怕的就是传染病的传染，以前没有办法做特别好的检验。
As early as in the 1970s, Taiwan Blood Service Foundation campaigned for voluntary non-remunerated blood donation to ensure safe and sustainable blood supplies.
我们全国的捐血率是 8.13%， 是全世界第一名。一个公益的社会就是一定要互助，血液的捐赠，这个就是其中之一。
The act of altruism has become a pillar of Taiwan's social foundation. For example, Yonglin Healthcare Foundation donated the NTU Cancer Center to improve the research and quality of cancer treatment. During the COVID-19 pandemic, vaccines are donated by companies and philanthropy groups.
实施全民健保到现在，社会上都形成一个可以互相帮忙的一个概念，让我们台湾更稳定、更安和、更进步。
Today, 1-year-old baby boy Ji Chu will receive a jab to stave off a common transmissible disease.
医师好。
今天要打的是 A 型肝炎这支疫苗。
早年因为台湾公共卫生的条件不是那么好，所以大概有1/2到1/3的儿童都曾经发生过 A 型肝炎的传染。在106年以后出生的儿童是可以免费接种 A 型肝炎的疫苗的。
While viral hepatitis infection has declined over the years, thanks to a high vaccination rate and improved hygiene, it is still among the world's leading causes of death. In Taiwan, the Ministry of Health and Welfare has managed to reduce hepatitis B infections by vaccination and treat hepatitis C patients by covering new drugs. While Pojar Charity, a not-for-profit organization, has pledged to spend over $50 million to donate hepatitis A vaccines. The collaboration of the public and private sectors helps Taiwan to eliminate viral hepatitis earlier than the target set by the World Health Organization. To facilitate research on diseases particular to the Taiwanese people, such as hepatitis, a biobank has been created.
This room is the most important room of NHI Biobank because it's the biosample storage room. This is a blood sample. We have many paraffin blood. This one is the liver tissue. The liver research in Taiwan actually is quite famous in the world. I starting to prepare to build Taiwan Liver Cancer Network in 2005. 现在在做是什么检体？
那个 liver RNA 的定量。
好。
The Biobank Consortium is run by National Health Research Institute, or NHRI. The state-level research center studies not only liver disease, but all medical conditions concerning the health of Taiwanese.
国家卫生研究院来做生理的、医学的、药物的各项的高阶的研究单位，它还可以提供卫福部现在在照顾民众健康时候的一个智库。他们也协助训练了一批癌症专科医师，已派到各大医院，也成立了资料库，可以作为我们国内学界研究的参考资料。
Biobank would be the fast way to build a big data for AI. The medical data will be very useful for promoting medical research, health, and precision medicine.
With a multifaceted approach to build a healthcare system, 3 decades after Taiwan's National Health Insurance Administration began its operation, the health outcome of the people in Taiwan has clearly improved.
健康本来就是一个天赋的权利，健康是你的身体、生理各项社会上的安宁完全状态才是健康。不论你的经济程度、社会地位、宗教信仰，还有你是哪一个种族的，我们在健康的照顾上都能够获得同等的一个水准，这才是健康平等。
OK，
好，谢谢。
好，谢谢你哦。
Today, the 1-year-old baby boy receiving the vaccine has a life expectancy of around 80 years. He has no need to worry about being financially crippled by medical bills. He is less likely to develop the conditions that cut short the lives of his ancestors, and more likely to live a healthier, longer life to pursue his full potential. By enacting public health policies, enabling technological development, and embracing social value, Taiwan is making big strides toward health equity. Its journey may provide valuable insights for others.